Come in. Hi, Mr. Stellon.
Hi, Dr. O'Hara.
I've called you in today to tell you the unfortunate news that your child has cystic fibrosis.
What are the symptoms?
CF has both symptoms of the respiratory and digestive systems. Respiratory symptoms include a persistent cough, wheezing, breathlessness, decreased ability to exercise, repeated lung infections, and inflamed nasal passage. Digestive symptoms include poor weight gain and growth, intestinal blockage, and severe constipation.
When will these symptoms occur?
These symptoms will begin immediately after birth and continue on for the rest of their life.
How will these symptoms affect the quality of my son's life?
Your son will need 50% more calories in a day than normal. He will not be able to smoke when he's older, and the individuals around the patient will need to constantly be washing their hands to make sure that they do not pass on lung infections to your son.
How will this affect the lifespan of my child?
Cystic fibrosis lowers the expectancy to 37 years of age, but as we will discuss later on, there are ways to elongate that time.
Will my son be able to have kids?
Cystic fibrosis is known to affect the reproductive health in males, and therefore your child will not be able to reproduce.
What's wrong with the cells in my son's body?
The cells in your son's body lack the cystic fibrosis transmembrane conductance regulator gene, also known as the CFTR gene.
How does that cause the symptoms you described?
The protein that is produced by this gene is responsible for helping sodium chloride move in and out of cells. And because this protein is not present, the movement is therefore blocked and thick and sticky mucus builds up in cells.
Are all my son's cells affected this way?
Because this genetic disorder begins during fertilization, all cells that come from the original ancestor cell through processes such as mitosis contain the same DNA, therefore the same problems with a specified gene.
So does that mean yes?
Yes.
And what chromosome pair is the affected gene found?
It is found on chromosome 7.
Is this an autosomal chromosome?
It is an autosomal chromosome and it is not sex-linked.
What's going on with my child's gene? Is the DNA mutated?
The DNA is mutated in one spot, therefore making it a point mutation, because there is only one letter in the sequence that is different.
Is the disease-causing allele dominant or recessive?
The disease-causing allele is recessive in this case.
How is this mutation related to the proteins made or not made?
This mutation was caused by an error in the protein synthesis, which is the process by which DNA encodes for the production of amino acid and proteins. Therefore, when the CFTR gene is trying to do its job of helping sodium chloride move in and out of cells, it is incapable of doing so, and therefore there would be a thick mucus buildup in the lungs.
How did my son inherit this disorder?
Because your son inherited the disorder, both you and your wife are carriers of the recessive allele that causes cystic fibrosis. As you can see in this Punnett square, the little a represents the disease-causing recessive allele for cystic fibrosis, and the two little a's together mean that your child has cystic fibrosis.
How can me and my wife not have the disease and our son have the disease?
Because you guys are both heterozygous carriers, the dominant allele shows up more than the recessive allele, and that's why you don't have the disorder. But your child, unfortunately, got the two recessive alleles for cystic fibrosis and therefore has cystic fibrosis.
What are the odds of our next child having the disease?
Just like your first child, 25%.
Is there a cure for this disease?
There's currently no known cure for cystic fibrosis, but there are several procedures to help lengthen the length span for the patient. For example, there's the nasal pulp removal, which helps clear up the breathing passageways of the thick mucus. There's the lung transplant, which should only be used for severe cases. And there's a feeding tube that can help deliver important and difficult to digest nutrients to your child.
Are these procedures easy to come by?
Most of these procedures are easy to complete, but the lung transplant is difficult because it's often difficult to find a donor for the lungs.
How often should these procedures be done?
The lung transplant will be done only one time, but the nasal pulp removal and the feeding tube will be done many times in order to lengthen the child's life expectancy.
Is there any hope for cures in the future?
Yes, there are. We're seeing advancements in stem cell research. Because donors are difficult to come by for lung donations, we have attempted to use stem cell technology to make a new lung that could later be transplanted. Thank you for coming in today, Mr. Stellon. If you have any other questions, please feel free to call me, or most of your questions will be able to be answered in this brochure.